Hi, this is Dr. Hanson from Infinity Health. Today with me I've had the pleasure of this month working with Trevor Sherburne, a medical student from Tulane University Medical School, and it's been fun to have him around. And so we figured today we'd go over a video of various types of musculoskeletal issues, and in particular a certain type of elbow pain. So I'm going to go ahead and hand this over to Trevor to talk about this type of elbow pain.
Hey, so today we're going to be talking about tennis elbow, and what that is it's a pain on the outside aspect of the arm. It starts up in the elbow and can actually go down the arm this way. It can also lead to decreased grip strength, so that can be painful. What causes tennis elbow? Tennis elbow is caused by repetitive motion, either athletic or just everyday motions. This means it's not caused by an injury where you fall or hit your elbow, but instead has a slow onset and progression, and will kind of gradually get worse. So treatment options for tennis elbow include changing to better equipment if you are an athlete. You can also use a tennis strap, which will usually go right around your arm right here. That's particularly for this tennis elbow pain. It's not like a sweatband or something like that, but actual strap that changes the tension from the muscles and tendons. Instead of being at the elbow where the pain is, it'll move it down the arm and relieve that pain. Otherwise, you can do some exercises. Dr. Hanson will demonstrate for us right here. What you want to do is put a rubber band around your fingers and actually stretch out your fingers and expand your fingers, kind of hold it for a few seconds, and just kind of continue those exercises several times a day.
Which is different than the standard type of tennis ball gripping type thing, right?
Yeah. So this pain can actually be caused by an imbalance of gripping too much and have that grip strength be too strong in relation to a weak extensor strength, which is why we recommend these. Other options are you can use some stretches. First the wrist, kind of doing this, and that's particularly good after your extensor exercises. Just stretch out that wrist, and that'll help stretch out these tendons and muscles that go down and attach at that painful site. Once you do those exercises and the stretches, you want to apply some heat or cold, whatever you find is better for you, to the painful areas of your arm. That should be able to help. And then if none of this stuff is giving you relief, go ahead and contact Dr. Hanson. Come in and see him, and he can do some kind of diagnostic tests, make sure that is what's going on, there's nothing else. And then usually you'd recommend PT or maybe an injection if you find it appropriate. Is that right?
Right, yeah, if it confirm the diagnosis, if you're really tender right there in that particular bony part of the elbow, and you've tried all these things already, then we would consider sending you to a physical therapist, a professional physical therapist, to give you the exact exercise what to do. And under severe instances, we may use a steroid and kind of a Novocaine injection into that particular part of the elbow to help relieve the acute symptoms. Yeah, so that's a good job. That pretty much sums it up. Pretty common condition, tennis elbow. I use the fancy word of enthesopathy of the lateral humeral epicondyle, but we won't use that against a mixed crowd. All right, so thanks for joining us again, and don't forget to subscribe, and also don't forget to look out for Trevor Sherburne out there in the medical world in the near future.